Supplemental Nutrition Assistance Program, SNAP, commonly referred to as food stamps, has long been a lifeline for millions of Americans. As of 2025, more than 42 million people depend on it to provide stability and access to nutritious meals. With the arrival of October, however, the program is entering a period of profound transition. New rules, revised benefit amounts, stricter eligibility standards, and state-level restrictions will begin taking effect on October 1st, and their impact will be felt across every corner of the country. These updates promise both welcome relief in some areas and daunting challenges in others, particularly for vulnerable populations like seniors, families with children, and those living in high unemployment regions. The background behind the changes, to understand why these sweeping adjustments are being rolled out, it is essential to look at the broader context. Over the past several years, lawmakers at both the federal and state levels have debated the future of SNAP, weighing its role in fighting hunger against concerns about costs, program misuse, and nutritional outcomes. Recent executive orders, combined with new legislative action, have pushed the program into what many are calling its most comprehensive overhaul in decades. These moves are not isolated decisions, but part of a broader strategy to redefine public assistance programs in a shifting economic and political landscape. Supporters of these changes argue that the program needed modernization, particularly in updating benefit amounts to reflect today's cost of living. Food prices have risen steadily, and many families have struggled to keep up, even with SNAP assistance. Critics, however, caution that behind the headline of increased benefits lies a set of new hurdles: expanded work requirements, stricter income tests, and state-imposed bans on certain purchases that could cut off benefits for millions who still desperately need them. The debate, therefore, is not simply about numbers, but about values, fairness, and priorities in a nation grappling with inequality. As these changes take effect, beneficiaries will be navigating a complicated new landscape that promises some improvements while simultaneously threatening access for others. October 2025 will likely be remembered as a turning point in the history of the SNAP program, one that reshaped not only how assistance is delivered, but also who is entitled to receive it. New benefit amounts and what they mean for families. One of the most immediate changes arriving in October is the increase in maximum monthly benefit amounts. For the 2025-2026 fiscal year, households of all sizes will see adjustments designed to bring SNAP payments closer in line with inflation. For example, a single-person household will now receive up to $298 each month, while a family of 4 will be eligible for as much as $994. Larger households will see similarly scaled increases, with a family of 6 potentially receiving $421 per month. For families already struggling with the rising cost of groceries, these adjustments will provide a modest but meaningful boost. While these increases are being celebrated by many advocacy groups, they are not without limitations. For seniors, particularly those on fixed incomes, the minimum benefit amount has inched up only slightly, from $23 last year to $24 this year. Critics argue that this tiny increase is insufficient to cover the true costs of a senior's nutritional needs, especially given the added burden of medical expenses. Seniors who depend on the program often find themselves rationing food or skipping meals, and the minimal adjustment does little to ease that burden. Nevertheless, the boost in maximum benefits signals recognition of a reality that has been ignored for too long: that food insecurity in America is not confined to a small minority, but affects millions, including working families and children. These changes, while not perfect, reflect an acknowledgement that SNAP must keep pace with economic realities if it is to remain relevant and effective. Income and asset limits under the new rules. Eligibility for SNAP has always hinged on both income and asset thresholds, and this October, those thresholds are shifting. For the general population, the gross income limit will now be set at 130% of the federal poverty level. This means, for example, that a household of 1 must earn less than $696 per month to qualify, while a household of 4 must fall below $483. These thresholds, though updated to reflect current poverty standards, remain stringent, and families on the edge often find themselves excluded even while struggling to meet their basic needs. Seniors and disabled individuals, however, will benefit from a slightly more generous standard. their gross income limit will be set at 165% of the federal poverty level, allowing them to qualify with up to $152 in monthly income. Advocates have long pushed for such adjustments, recognizing that seniors and disabled individuals often face higher costs for healthcare and other essentials. Even so, many critics argue that these limits still exclude too many households living just above the poverty line, but who remain food insecure. Asset limits are also being updated. For the general population, the cap will remain at $3,000, while seniors and disabled individuals will be allowed to retain up to $4,500 in assets without disqualifying themselves. While these thresholds acknowledge that some level of savings is necessary for stability, they also place a ceiling on what struggling families can hold onto. This can create difficult choices, as households may be penalized for modest savings intended for emergencies or retirement. Work requirements and their expanding reach. Perhaps the most controversial element of the October changes is the expansion of work requirements. Previously, these rules applied primarily to able-bodied adults without dependents, requiring them to document at least 20 hours of work per week. Beginning this October, however, the scope of these requirements will grow dramatically. Older adults aged 55 to 64 will now be subject to the same standards, as will parents of children aged 14 and above. Exemptions that once applied to veterans, individuals experiencing homelessness, and young adults who had aged out of foster care are being removed. The consequences of this expansion are staggering. The Congressional Budget Office estimates that 1.4 million people could lose SNAP benefits each month under the new regime. Families with teenagers, older adults nearing retirement, and individuals struggling to find stable work in difficult labor markets are all at risk. In many cases, these are households that rely heavily on SNAP to bridge the gap between low wages and rising costs. Making matters worse, the new rules also limit states' ability to grant waivers in areas of high unemployment. Under the previous system, states could exempt residents in regions where jobs were scarce. Now, only areas with unemployment rates above 10% will qualify. This standard is far stricter and could leave many people in struggling communities with no safety net at all. The effect will likely be most pronounced in rural and economically depressed areas, where job opportunities are scarce and transportation barriers are high. State-level bans on junk food purchases in addition to federal-level reforms. October will also see new state initiatives restricting what SNAP benefits can be used to purchase. Historically, the program has permitted the purchase of nearly all foods, excluding alcohol, tobacco, hot foods at the point of sale, and non-food items. Recently, however, a growing number of states have begun banning the purchase of so-called junk foods with SNAP funds. This movement, once largely symbolic, is gaining real momentum. States such as Florida, Texas, Louisiana, and Oklahoma have already implemented bans, restricting SNAP purchases of items like soda, candy, and processed snacks. These rules are controversial, with proponents arguing that taxpayer dollars should not subsidize unhealthy foods, while opponents warn that such bans unfairly stigmatize low-income households and limit personal choice. The list of states considering similar bans is growing, and it now includes large states like Pennsylvania, Michigan, and Ohio. If the trend continues, these restrictions could spread nationwide. For beneficiaries, this means navigating a patchwork of state-specific rules that complicate already difficult shopping decisions. For families with limited access to fresh produce or affordable alternatives, the bans may create new barriers rather than solutions. Navigating the new SNAP landscape for those who rely on SNAP, the upcoming changes can feel overwhelming. However, there are strategies for adapting. Staying informed is the first and most critical step. Beneficiaries should regularly check updates from their state SNAP offices and the USDA to ensure they understand the rules specific to their location. Awareness of key dates, deductions, and eligibility requirements will help households avoid disruptions in benefits. Another important step is to review eligibility carefully during recertification. Many families who previously qualified may now find themselves on the margins. Documenting every eligible expense, especially for seniors with medical costs, can make a significant difference in the benefit amount received. Families should also be vigilant about work requirements, keeping accurate records and submitting documentation promptly to avoid benefit termination. Finally, beneficiaries should seek out local advocacy and support organizations. These groups can provide guidance, resources, and sometimes legal support for individuals facing reductions or terminations. In an era of rapid policy changes, having allies who understand the system can make the difference between navigating the changes successfully or falling through the cracks. The broader social impact the October changes to SNAP will have ripple effects far beyond the households directly affected. Expanded work requirements and state-level restrictions are expected to increase food insecurity among vulnerable populations, including children, seniors, and veterans. For communities already struggling with poverty, these changes could exacerbate inequality and deepen divides. At the same time, the increases in maximum benefits and income thresholds provide some relief for households that remain eligible. These improvements highlight the dual nature of the changes. While some families will benefit, others will lose access entirely. The result will likely be a reshaping of the SNAP population, with some groups faring better and others facing heightened precarity. In the long run, these reforms will test the resilience of America's social safety net. They raise important questions about the purpose of public assistance, the role of personal responsibility, and the balance between cost control and compassion. How these questions are answered in practice will determine not only the future of SNAP, but also the broader trajectory of social welfare policy in the United States. Final thoughts: the arrival of October 2025 marks a turning point for SNAP beneficiaries. With higher maximum benefits, stricter income and asset limits, expanded work requirements, and new state bans on certain purchases, the program is entering a new and more complex era. For millions of Americans, these changes will determine not only how much food they can put on the table, but whether they can remain eligible for assistance at all. While the increases in benefit amounts may provide a glimmer of relief, the risks posed by tighter restrictions and expanded requirements are real and far-reaching. Vulnerable groups such as seniors, disabled individuals, and families with children face particularly uncertain futures. As these reforms unfold, staying informed, documenting eligibility, and seeking support will be critical for those affected. Ultimately, SNAP has always been more than just a program. It is a reflection of national values. The changes beginning this October will test those values, challenging the country to balance efficiency and accountability with compassion and fairness. For the millions who depend on SNAP, the stakes could not be higher.